Hey, my name is Kellie Woodfield. I'm an OBGYN resident at the University of Utah, and this is my poster called The Premarital Exam, A Patient's Perspective. So premarital exams in the Intermountain West have faced sharp criticism in recent years with claims of underlying misogyny and that it leads to the propagation of outdated heteronormative notions of female sexuality. Although premarital exams appear to be common practice throughout this region, what occurs during these visits and the perception of women seeking them is unclear. This research explores the content of these exams and the experience of women who utilize this clinical service. So this was a qualitative focus group study conducted from June to July of 2021. Participants self-identified as female and underwent a premarital exam in Utah in the past 5 years. We recruited via social media platforms and community flyers. Groups were conducted virtually over secure Zoom platforms using a semi-structured interview guide, and participants were compensated. We coded focus group transcripts in an iterative manner and identified major themes based onto the codes. So we had 40 participants divided amongst 6 focus groups. The median age was 24, 98% identified as a member of the Church of Jesus Christ of Latter-day Saints, and 80% had a degree beyond high school. We found that there was no premarital exam equivalent for men. Women often sought exams either at the suggestion of female friends or family members or simply as a cultural norm prior to their wedding. We also found that fundamentally the premarital exam consists of a pelvic exam, contraceptive counseling, sexual education, and the prescription of vaginal dilators. So looking at each of these components separately, so patient themes around pelvic exams included patients desiring reassurance that they were, quote, normal down there. They often had an expectation that their hymen would specifically be examined and, quote, broken by the doctor. They believed their vagina was evaluated as to whether it was ready for sex and could accommodate a penis. Also, the exam was emotionally traumatic for some, often bringing up questions as to if they actually consented for the exam. So themes surrounding contraceptive counseling included that securing reliable birth control was a primary objective for these women. They also exhibited a strong sense of autonomy over their bodies, desiring personalized counseling and to know the risks associated with each option. Although the premarital exam provided access for many women to secure contraception, it became a barrier for others who were told that they could only get birth control if they scheduled a premarital exam. Themes surrounding sex education were that participants expected providers to be unbiased, factual, and not relying on personal experience in their counseling. In fact, counseling that was based on outdated cultural norms around female sexuality or relied on personal experience of the provider was sometimes perceived negatively. A major theme that emerged from this study was participants' concern that sex would be painful. They wanted providers to give more information on this topic and to discuss pain mitigation strategies. Although not something they came into exams wanting, in hindsight, many women wish that they would have had more instruction in female orgasm. Finally, regarding vaginal dilators, the perceived purpose of dilators was to physically stretch the vagina in order to accommodate a penis, thereby minimizing pain with coitarchy. Women were split as to whether dilators were helpful or harmful, with each group holding strong opinions on the subject. For those who found dilators helpful, they appreciated the confidence and control dilators provided, as well as perceiving them as anatomically necessary before their first intercourse. For those who found dilators harmful, they cited pain and guilt with use and discomfort with the notion that a female body needs medical prepping for sex. Lastly, not all dilators prescribed were medical grade, as many women received plastic centrifuge tubes or even plastic speculums to use. So in conclusion, these themes do support the use of premarital exams among women with little knowledge about sexual health and anatomy, though exams often included practices at odds with accepted standards of care. There's therefore a need for a modern replacement, one that is grounded in evidence-based care and value-neutral counseling, while also available to individuals of diverse gender, backgrounds, and sexual experience.